Good morning, Emily and team. I thought I'll make this video as we seem to be missing each other. Emily, this is a quick brief overview and training on how to use PepFactor for both skin and scalp. First thing that I'm sure you've already received would be your PepFactor kits. You would either have received them in the older boxes, the single boxes that look like this, which is 1 kit per box, or most likely in the new boxes, which is a box of 6 PepFactor kits at a time for skin and scalp. When you open it, for example, on the scalp, you'll find that there are 6 vials with blue liquid in it. This is your copper peptide, which is the DHT blocker, and then 6 of the powder for growth factor. You'll find that in either skin or scalp treatments, the powder is always the same. The only thing that changes will be the liquid. Instead of copper peptide for the skin, we use hyaluronic acid. So the copper peptide is a DHT blocker, whereby the hyaluronic acid is a very mild acid to help to even out the skin tone, but it has many other benefits. Great for moisturizing and so on. And many people use this as a ongoing treatment for their skin. And the copper peptide is also amazing for wound healing and many other things. You can just go to Google Scholar and research it, but great to pair with the scalp. Sometimes people ask me if I do not have a PepFactor kit, I only have scalp kits. Can I do the skin with the PepFactor scalp kit? Yes, you can. And you can do also a hair regrowth treatment with the PepFactor skin kits if you somehow don't have enough of the scalp kits. But it's recommended to use the scalp specifically for scalp and the PepFactor skin specifically for skin. So I will show you later on how to mix the PepFactor scalp and skin. In fact, I'll mix it now. So prior to starting your treatment, you'll find that the hyaluronic acid for skin is very thick. It's specifically done that way so that when you apply it to the skin, it doesn't flow off. However, because of that, it does not mix as fast as the PepFactor scalp kit would. So the best thing to do is to open it up and leave it for 5 or so minutes prior to treatment. So take for the skin, you'll take one of the powders, the PepFactor, it will say PepFactor powder on it, and one of the hyaluronic acids. To open the vial, you'll see that there are 3 little arrows pointing up, and you put your thumb under where the arrows are, put your finger down and pull and twist down, and it will come cleanly off like that. Then what you do is you simply, be careful, you simply just open this up like that. It will twist open, and then just pull it open like this and remove the rubber stopper, and it's open. Sometimes the doctors or nurses or NPs would prefer to draw out the liquid with a needle and then inject it in here, but I just find this is the easiest way. To open the powder, there are no arrows. It will have a white cap. Simply pull off the top white bit, and you'll find that inside it has a little bit of, almost like a Coke or a Pepsi can or any drink can you can open, a little tag. It's normally down like this, and you can just put your nail in there and open it. And then all that you do, again, you pull very carefully, put your finger down there and just bend it open, and it just comes off like this. At the top, you'll see a silver little cap that you again just pull off, and then you have another rubber stopper and you pull it off. And now you're ready to mix. So what you would do, take the liquid, so both the copper peptide or the skin kit and the scalp kit works the same. You take the powder and you mix the liquid in. Now when you mix the liquid you'll find there's more liquid, there's 10 milliliters of liquid for the skin kits and 5 milliliters for the scalp kits. You'll be giving the balance of the product for your patient to take home, and on the skin it will be great for a few days more. They'll be able to keep on applying, and just apply approximately a half of the liquid for the skin kits in of the copper peptide. You'll add all of the copper peptide for the scalp kits in. So just to go over it again, so this area from here, the forehead area, the treatment depth would normally be between 0.25 to 0.75 millimeters, and in very rare circumstances, maybe a bit more. What I mean by rare circumstances, you'll find that some people have slightly thicker skin, and if you do not see any redness, you'll need to go a little bit higher. So the end point, or the point that you know that your treatment works, is when you see, as you do the treatment, it becomes nice and red, and sometimes you may see a little bit of pinpoint bleeding. Also, when you will go deeper, you may notice that I have this furrow here. I've been working on that. I only did one treatment, and already to a significant degree, it's reducing. I'll send you another video when it's gone. And there you pull it open like this, and then in this case, I would go as deep as even 2, just to basically make sure that I get collagen regrowth in this particular area. And then, of course, any wrinkles, you can just go across, and you may go a little bit deeper because you want to see at least pinpoint bleeding on those areas. As you do the treatment, be sure to always communicate with your client or patient, and basically just always ask them, how do you feel, and explain to them what you do. I show them the depth before I start, because I find that most people are scared of skin needling. So when I show them the depth of how deep the needle go, and with a white book behind it or a sheet of paper, they quickly realize it's not going to be like a major injection or anything like that, which is what sometimes they may expect. If you talk about skin needling, the biggest pain factor comes from the word, well, the phrase rather, skin needling. So, I'm going to do a skin needling treatment on you. Most people are scared of needles. Then the rest of the areas, so around the cheek area here, you could go deeper. You could sometimes go as deep as 2.5. When would you do that? The average would be 1.5 millimeters. But if you feel with your finger like this and somebody has significant deep scarring, one way you could break it up is actually by using the pen and going to 2.5 millimeters and physically break it up. You will find that when you do that, within a week or so, when you feel again, there'd be hardly or any deep scarring left, which is truly amazing. I find that very satisfying to see that happening, and the clients are very happy when they feel that they don't have that scarring anymore. I'm just shaking this a little bit. It's now just over maybe 10 minutes, and it's still a little bit cloudy, but you can use it like this. Then the area here above the lip, of course, will be more sensitive. So there you'd go back to 0.25, around the chin here as well, and around here about 0.75. And how would you know? With each client, it would vary a little bit every time. Some people have a higher tolerance for discomfort or pain. Other people just want a result. So they'll say, look, do what you have to do. I want a result. And what I would recommend is do the treatment on yourself, and you will find that exactly what's the right settings. When you go down around the neck, so you can do the neck and the décolletage as well as the hands. Around here again, because the skin is very thin there, you'll find that 0.5 is fine, sometimes 0.75. Again, your end point is when you see the skin appearing red. And I like to say it's like coloring in a book, or a picture rather on a book. So you color it in, and when you see red and little bits of blood, just very small amounts, then that's fine. Not a lot, but just maybe a pinprick here and so on. If they want you to do their lips at the end, which more and more people want done, you can do that. And we find that if people have dryness of lip, that stops the dryness, and also it will plump their lips out over time, because they'll have more blood flow there. The technique there is at 0.5, and instead of doing this motion, just hold, and hold. So let's discuss about the movements with the machine. On a line, you'd be moving the machine from side to side. If the machine is 1 millimeter set at the depth of 1 millimeter or lower, you can simply just do circular motions, crisscross motions, and lines. Okay. Just be sure. So for the scalp treatments, you'll be using the PepFactor powder and combine that with the copper peptide. So again, you'll just take the white top, pop it off. You just take this again, take this little silver tab, pull it. Just make sure you hold it with both your fingers and just pull it down like this. Just nice. It's a little bit difficult sometimes. Just pull it. You can also use something, a pen or something, put it through there, and you'll see it will just pop off easily. Discard. Take the little silver top off, discard, take the powder off, the little rubber stopper out, and discard it, and there's your powder. The copper peptide, again, just have like the white one, just a tab. Again, you just pull it, and you'll find with the copper peptide exactly the same. It will have a little tab. Pull that tab up, and then again the same procedure, just pull it and gently push it down, and you'll find it will very easily open like this, and it's exactly the same procedure. And what you now do, you simply just pour the liquid in, all of it, in the case of the copper peptide. Close it with your rubber stopper. Shake, and it's ready to apply. You'll see there'll be a slight milky, but it will very quickly go to the blue. You'll find that it's now about 15 minutes, and our mixture for the skin is still a little bit cloudy, but that's fine. You can use it like that. So for both of them, what you will now do is just take a syringe, and you can put the syringe in and you can draw up the liquid. We also have these witches' hats available. If you want them, just ask me, we can send you some. And they go on like this. So you just simply push them over the bottle, and they have a little cap. You can shake it, and then we call this the witch's hat because it looks like one. Just take this off, and you are ready to do the treatment. You'll find that on the witch's hat, if you take it like this, it will just, a little drop would come out, or you can just squeeze it, one drop at a time, and then the skin needling process. And of course, I'm using the copper peptide now on my skin. So I'm going to set it to 1. And now I'm just going to turn the pen on the highest. And now the motion is just circular motions across the treatment area. And I'm at 1 now, and there is no pinpoint bleeding at all. So I'll just keep on doing that. Feels a little bit discomfort, but not much. And all I'm looking for is redness. And you can see there how it's starting to turn red. And so that's on a bony area, and so you'll just keep on going the whole area. And you'll find that even the copper peptide is, it feels really good. It's really nourishing and easy for you to glide the pen over. So the reason why you would put the PepFactor serum on once you've mixed it on top of the skin and then needle, excuse me, is for 2 reasons. Number 1, the pen will easily glide. That's the first thing. And the second thing is the molecule of the product is too large to go into the skin, just through the skin barrier. You need to create channels, and your little needles are doing that. On the skin, what you would do, obviously you'd wear gloves, but in my instance, because I'm at home and it's my skin and my hands are washed, I'll just use product. And so what I would do, if I'm now going to, for example, do a treatment here on my skin, I'll put it at 0.75 and put the serum on. I've got the wrong one, I'll just get the right one. Get another little witch's hat. And so either you can use the syringe, or I'm going to just use a witch's hat because I do not have syringes. I prefer the syringes, they're easier. And then shake it up a little bit. And I'll put it on the treatment area. And you can do this at home yourself. Rub it in a little bit with your glove on your patient. And then I'll put the pen on the fastest. And you can see I'm actually going to be at 0.75. And then you just pull back and do the treatment. And of course, on the pen on, it'll vibrate. And that vibration, if you hold it, you'll feel it creates vibration and percussion. When I put it at 5, the highest, just that vibration in itself significantly reduces the feeling of discomfort. So on the lips, stamping, just a few seconds at a time, and around here, it will be 3 seconds, making sure you hold the skin tight. And so then 0.25 to 0.75, sometimes 1. Make sure all of the wrinkle areas, open them up and do the treatment inside. If they have very thick, deep wrinkles, you may go up to 2.5. When you do the treatment from 1.25 or more, instead of circles, you'll be doing stamping. But remember, after every treatment, set the pen to just 1 millimeter and just make sure you cover the whole area very quickly with round little circles. Go up to the ear by pulling up to ear. There's no one feels you, and it feels really strange when you do the treatment there. And then 0.5 to 0.75 around the neck and décolletage area. And the hands, sometimes you could go up to 1.5. Just look for pinpoint bleeding whenever you do the treatments. So that concludes the the skin treatments. Let's go on to the scalp. So it's fairly easy. So you're going to be approximately 1.5 to 2 sometimes, but mainly 1.5 at the back. Start at the back, move forward, and then adjust accordingly to maybe as little as 0.75, very seldom 0.5, but normally you'll be between 1 and 1.75 here. On the under the eyes, to recap, would be 0.25, and I mentioned feathered, so under the eyes just go like this and really lightly do it, because you want to try and smooth this out, which I'll do later today myself. And then if they, so the protocols, if they already have acne, so let's say they already have an open acne, the very first treatment, you do not need to do any needling at all, particularly if they have a lot of acne. All that you do is you use, let's say, 24 or similar gauge needle, something around that, a hypodermic needle, lance the acne and ask your client or patient to squeeze it out, or you can do it yourself. Make sure you lance all of them where you can and extract them all, and then when you put the PepFactor on, it will automatically go into their skin. You do not need to create a channel. The channel's already there. Provide them with the rest of the product that you have not used to take home, and ask them to put it on as often as they can in the next 24 hours. Every time that it goes dry, add some, and this will help. That's the kookaburras. There's loads of birds around here. So that will help them to that will help them to really get a good result. Time frames. Book your patients in no more than 7 to 14 days in particular for both scalp and skin for the first 3 treatments. It's very important that they come in so that you can get a continuity and get fast results. And then the number of treatments that you would require, if the acne is significant, for acne treatments first, you'll find that you could probably do that. You could probably stop most of the acne after the very first treatment. Their skin would, in most cases, not be irritated and painful anymore, and they won't have so many acne coming out. In fact, there'll be very few, maybe a few pimples, maybe 4 or 5 the next time you treat them. You can also give them a hypodermic needle to take home, to extract and to apply any product that's left. The week later, you follow the same procedure for skin. If they have acne, extract again all of the acne, and but in this case, you'll start to do the first skin needling. And avoid the open active acne and go around in circles. And then at the very end, what you can do, if there are any acne left that you could not extract, take the pen, put it on 3, just hold it on there for about 3 seconds, and you'll find that acne, they'll be able to get it all out then. It works really well. It's important to look at your own state regulations to make sure that you follow the protocols and procedures and that you go the right depth. But these are just things that work for me where I do the treatments. Then finally, how soon would you see results? When you do a treatment on skin, if it's for anti-aging, they will most likely see a result the very next day. I strongly encourage you to do a treatment on yourself and for all of your staff to do a treatment on themselves so that they can actually experience the feeling themselves, and you can do treatments on each other. If you have any questions, please feel free to WhatsApp me on +1 61 430 960 262. That's +61 430 960 262. You can also call on, or text me on +1 718 697 997. Those are US. That's a US number, but it will follow me here to Australia. Or you can call me on my Australian number, which is +61 430 960 262. Don't be shy. Feel free to text or call at any time. WhatsApp is always easier because I'll be able to send you images and you can share those with me. When it comes to the scalp and when you will see results, you can expect to see results there realistically after about 3 weeks to 4 weeks. After the 4th week, you should see little white hairs coming out. They will turn into what's known as the terminal phase. In other words, they'll go to the natural hair color after a few weeks. And bear in mind that the hair follicle, or the hair rather, only grows 1/4 of an inch in a month on average. For some it will be more, some less. So some patients will happen much faster. African American in particular have a very good response. We don't know why. And then, for other people it may take a little bit longer. Everybody's different. But